My advice to clinics who want to incorporate remote care into their CI care model would be to focus on one area, focus on one population. Perhaps it's those patients that always need tweaks after their appointment with you. Start there and figure out how you can build a telehealth program around that and then build from there.
Michigan Air draws patients from all over the state of Michigan. So when we had the option to integrate connected care into our protocols, we were very, very anxious to do so. Anything that we can do to make access easier for our patients was something we wanted to do.
In our team, we had one or two clinicians who were really interested in getting into remote care. So it was great to let them have the experience and then feedback at our team meetings so that it could help get the other clinicians on board. We were provided really good training opportunities through Cochlear. We did have a few questions on things that we weren't sure of in the early stages, like what sort of thresholds on the audiogram would be, what you would expect, or what do the results of the speech and noise test really mean. So once we had access to that information, we felt a lot more comfortable about using remote check.
Using remote care has really helped us with changing our clinic protocols. We've looked at recent studies provided by the American Cochlear Implant Alliance and recommendations from Cochlear about seeing patients a little less. I personally have been working with this since about 1998, and when I think of how many times we saw patients, it was really just too much. And we weren't doing that many things at each subsequent appointments. So seeing patients using remote care after we have activated them and we've optimized their hearing, now remote check can just work on maintenance. And so now when I tell a patient we have this option, they're actually pretty pleased. They don't have to get in the car, they don't have to drive down, and they know that I'm still checking on them without them having to physically come here, and it reduces their booth anxiety. So they're able to, in the comfort of their own home, test their hearing. I can check their electrode impedances. I can even look at their wear time and remind them, hey, remember we talked about wearing the processors this much? I can give feedback to them. So it's been a very seamless transition to using it. It's made me more efficient as a clinician, and I'm still able to give the same level of care to our patients.
So when it comes to, for us, integrating remote care into the actual protocols, we did a lot of trial and error in clinic beforehand, what worked, what didn't work, try it with one person, then try it with lots of people. And then once we felt comfortable and something was working for us, only then we would put it into our protocol and have that then signed off for the rest of the team and everyone trained as this is how we do it now.
So when it comes to scheduling remote care within our clinical hours, we tend to set aside some time each week to perform any remote care appointments. Remote check components, typically we schedule 15 minutes per recipient. When it comes to remote assist, it's really decided on the day how much time they will need allocated, but typically it's about 30 minutes.
If I had my time over, there's a couple of things that I would have done differently in terms of my use of remote care. The first thing is that I would have got on board with it sooner. We had really good support from Cochlear in terms of training, and we were offered the opportunity to get on board quite early on. But there was a little bit of resistance from the clinicians. It's always difficult to integrate new things into your practice. One way I think would be really helpful is to use a team approach. So the way we did it was relying a lot more on individual clinicians' motivation and just starting to use the technology themselves. But if we're able to approach it from a team perspective and onboard people that way, trying to set some goals to encourage clinicians to use remote care, celebrating when we achieve certain milestones. So we had 100 enrollments recently, which was really exciting.
My top tip for integrating remote care into a clinic would be to research whether your clinic or institution has a virtual care team. And if you do, to immediately start working with them to figure out how they can help guide you along the process.
Using remote care has helped us double the number of patients we see in a very short amount of time. And we could not have done that without remote care. Being that we can now see patients for these visits either asynchronously with Remote Check or synchronously through Remote Assist, we're able to now take on more patients than we ever have before because we have the time to see those evaluation appointments and get more patients access to better hearing much, much faster than we ever have before. It used to be a several month wait to get in for an evaluation, and we have now trimmed that down to a matter of weeks.